All right, today we are going to show you just a basic cheek touch-up. This patient has had cheek filler in the past, and so today we're just basically going to add a little bit of extra volume to help support the midface, which will in turn soften the deficits that she sees in the lower face. Appropriate support in the midface is so incredibly important because if we lose the support in our midface, then we can't really keep that skin where it belongs. And what happens is it sort of starts to sag because we're losing that volume. And so you see here, we have outlined in her face just a triangle. This is just reminding the injector that some of the safety zones. So this was a training with a newer injector. And, generally we're very careful about crossing that medial line to avoid coming too close to the infraorbital foramen. You can see that we have her infraorbital foramen marked. So in the event that we had to go past that medial line, we know that we're safe if we're at least staying a good distance apart from that. So we are using a heavy filler in this instance because we're looking to restore some structure and support. And we are placing product deep on bone as we do with the heavier type fillers. So you can see here, she wants to come medial, but our infraorbital foramen is a very safe distance away. And so therefore, we're comfortable injecting deep on bone in this particular area. And once we are able to restore the support in her midface, oftentimes their nasolabial folds appear softer. You can turn up sort of the corners of the mouth, the oral commissures, and in the right patient, it can help with jowling. These patients tend to have very minimal deficits who get the improvement from the jowling. I don't like to oversell the lift that you get from cheek filler, but in the right candidate, you absolutely can get a nice lift. And so here we're just sort of touching up some areas that looked a little bit flat. And we're just working our way back along the zygoma, administering our product deep. And as you work your way back, it's important to sort of taper the amount of filler that you're giving so that way it has a very natural appearing transition to the lateral aspect of the zygoma. So you can see here she's deep on bone. As always, we aspirate prior to any injection. It's important that we do so to minimize the risk of injecting into a vessel. Certainly aspiration is not 100% guarantee that you're not in a vessel, but about 60% of the time it is accurate, and therefore that is 60% of the time that we can get some reassurance that we're in a safe zone. And you can see her, she's just giving a very small amount to soften that transition between where she injected a fair amount of filler and working the way back. And then this will probably be her final injection here. We teach cheek filler in our level 1 dermal filler course, and this is the course where the wheels really start turning. You're advancing your skill set. You're able to offer so much more to your patients than just filling their nasolabial folds or oral commissures. Those are all a symptom to a bigger problem, the oral commissures, the nasolabial folds. The bigger problem is lack of mid-face support, and so now that we're teaching cheeks, we are really able to help offer them so much more. So I always recommend taking our level 2 dermal filler course to help advance your practice and offer your patients really what's appropriate for them. Most of the time, cheek filler is always first. If after the fact they still need those areas, the other areas filled, then you can, but you'll end up using less filler, which will appear more natural. So we always start with cheeks and then reevaluate and determine whether or not we still need dermal filler in, for example, the nasolabial folds, or if treating the cheek alone helped soften those concerns for the patient. Perfect. And then after dermal filler, we always like to smooth and make sure that everything feels nice and smooth, no lumps or bumps. You don't really want to leave like a very firm piece of filler in there, and then the patient can feel it. So we just like to smooth out some of those boluses. We certainly don't want to flatten it because it's exactly opposite of what we're trying to accomplish, but just make sure that they're nice and smooth. And we just use a little bit of arnica gel for our fingers to glide over nicely the treatment area. So we hope to see you in a level 2 dermal filler course so that you can offer these services to your patients as well. We'll see you next time.